So the heart sounds S1 and S2 are the normal heart sounds, and each heart sound has two components. That is one from the left-sided, which is either aortic or mitral, and one from the right-sided was, which is either tricuspid or pulmonic. So let's suppose this is S1 heart sound. So it will have one component from the left-sided valve, which is mitral valve over here, and one component from the right-sided heart valve, which is tricuspid valve over here. Similarly, the S2 is the second heart sound, which has the left-sided valve component and is aortic valve, as well as the right-sided valve component, which is the pulmonic valve. So S1 from the closure of the mitral valve and tricuspid valve. S2 is from the closure of the aortic valve and pulmonic valve. S1 is usually single sound. The two components are close together. So usually in S1 heart sound, the two components, that is the mitral valve closure and the tricuspid valve closure, which will make a sound, they are close to each other and cannot distinguish separate sounds. The S2 can be split. So the two components far enough apart to be audible. So when you hear the S2 sound with stethoscope, so the closure of the aortic valve and pulmonic valve may be far apart to be audible on the stethoscope. So S2 sound can be split while S1 is usually a single sound. The physiological splitting of S2 sounds. During exhalation, the S1 and S2 sounds are alike. That is, the closure of the mitral valve and tricuspid valve will make a sound which is audible on the stethoscope and will make S1 sound, while the S2 sound is made by the closure of the aortic valve and pulmonic valve. So S2 heart sound is by closure of the aortic valve and pulmonic valve. During exhalation, there is no splitting of S2 sound, but during inspiration, the S1 sound will not split, as we already discussed that usually it is a single sound, while during inspiration, the S2 sound is splitted, and this is called the physiological splitting of S2. This is because when there is inspiration, there is increased venous return that delays pulmonic valve closure by 40 to 60 milliseconds. So when blood comes to the right ventricle and then it exits by the pulmonary valve, so this closure is delayed by 40 to 60 milliseconds during inspiration in normal individual, and the S2 sound is splitted, which is called physiological splitting of S2. So during exhalation, S2 is a single sound, but during inspiration, the S2 sound splits.